Okay, let's dive into this. Picture this. You're a scuba diver, deep down, exploring maybe a wreck or a reef. It's amazing.
Yeah, totally serene down there.
But then, as you start coming back up, something just feels off.
Yeah.
Your body isn't reacting well to the pressure change.
It's kind of like, opening a bottle of soda too quickly.
Exactly, that fizz, those bubbles.
Huh.
Imagine that happening, but inside your body.
It's a really good analogy, actually, and it leads us right into our topic today. Decompression, and specifically a really fascinating treatment called hyperbaric oxygen therapy.
Right. And our mission today for this deep dive is pretty straightforward. We want to understand how this therapy helps divers when they run into these pressure problems.
Yeah, get the basics down without needing a medical degree.
Think of it as your shortcut, yeah. A way to grasp a medical treatment that can genuinely save a diver's life.
And to do that, we've pulled together some solid sources. We're talking established medical guidelines for using this therapy, a specific handbook on hyperbaric medicine for diving issues, a medical dictionary that explains the gear, the chambers, and also a pretty comprehensive textbook that gets into the science behind it all, especially for divers.
So a good range. Should give us a clear view.
Definitely. Focused right on decompression.
All right. So let's start at square one, maybe for listeners who aren't divers. What is decompression in this diving context?
Okay, so when you dive, the water pressure around you increases, right? A lot.
Makes sense. More water above you.
Exactly. And this higher pressure causes the gases you're breathing, mostly nitrogen from the air in the tank, to dissolve more easily into your blood and your body tissues.
Kind of like sugar dissolving in hot tea. More dissolves when it's hot. Or pressurized in this case.
That's a great way to think about it. More pressure means more gas dissolves. It's just physics. Boyle's law, basically, relating pressure and gas volume, or how much can dissolve.
Okay, got it. So down deep, your body fluids are holding more dissolved nitrogen. What's the issue when the diver decides to surface?
Well, the problem comes if the ascent is too fast. As you come up, the pressure around you drops.
Right. Less water, less pressure.
And if that pressure drops too quickly, the nitrogen that was dissolved doesn't have time to sort of leave your system gradually through your lungs. Instead, it comes out of solution inside your body, forming tiny bubbles, like opening that fizzy drink suddenly pop. Bubbles everywhere.
Inside your tissues and bloodstream.
Precisely. And those bubbles are bad news. They can block blood flow, press on nerves, cause inflammation. That's what we call decompression sickness, or DCS.
Ouch. Yeah, bubbles where they shouldn't be sounds. Really not good. So how does this hyperbaric oxygen therapy help fix that specific bubble problem?
Okay, so hyperbaric oxygen therapy involves putting the diver inside a special chamber.
A pressure chamber.
Exactly. And inside that chamber, they breathe pure 100% oxygen. But here's the key thing. The chamber itself is pressurized. The pressure inside is higher than the normal air pressure we experience at sea level.
Higher pressure. So you're kind of simulating going back down deep in a way.
In terms of pressure, yes, that's part of the idea. And it's crucial to understand this isn't the same as just giving someone oxygen with a mask in an emergency room at normal pressure.
Okay, that's an important distinction. So breathing oxygen at sea level pressure isn't hyperbaric therapy.
Nope, not at all. The hyperbaric part, meaning higher pressure, is absolutely essential for treating decompression sickness effectively. That added pressure is what makes the magic happen, so to speak.
Got it. The pressure's the special sauce here. So how does this combination, the high pressure and the pure oxygen, actually help the diver's body deal with those nitrogen bubbles?
Well, there are a couple of main things happening. First, the high pressure itself physically squeezes the bubbles. Remember Boyle's law. Increased pressure, gas volume decreases, so the bubbles get smaller.
Okay. Direct physical effect. Shrinking the pressure.
Exactly. But just as importantly, breathing pure oxygen under that high pressure dramatically increases the amount of oxygen dissolved in the bloodstream. Way more than you could ever get just breathing oxygen at normal pressure.
So your blood becomes super oxygenated.
Pretty much. The plasma itself, the liquid part of the blood, starts carrying loads of oxygen.
And how does that help with the nitrogen bubbles?
Well, think about those bubbles. They're mostly nitrogen, right? When the tissues around them are flooded with this high concentration of oxygen, it creates a steep gradient.
A gradient, like a slope.
Yeah, a pressure difference. There's lots of oxygen outside the bubble and mostly nitrogen inside. This encourages the nitrogen inside the bubble to dissolve back out into the tissues and bloodstream,
Oh, I see.
where it can then be carried away and breathed out safely by the lungs. The high oxygen helps flush out the nitrogen, essentially, while the pressure keeps the bubbles small.
So it shrinks them and helps get rid of the gas causing them. That's clever.
It really is. There's also another benefit. Sometimes diving air can be contaminated, maybe with carbon monoxide from the compressor.
Oh, right.
Hyperbaric oxygen is also exceptionally good at clearing carbon monoxide from the body much faster than just normal oxygen. So it can help with that too, if it happens to be a factor.
Okay, that makes a lot of sense. So tell me about the chamber itself, this pressurized room. What's it like?
Right. Well, it's basically a pressure vessel. A strong, sealed container built to handle pressures significantly higher than normal atmosphere.
Like a mini submarine, but for staying put.
Sort of, yeah. And they come in generally two main flavors for treating divers. There are monoplace chambers, mono meaning one, just big enough for a single patient lying down.
Okay.
And then there are multiplace chambers, which are larger rooms, really. They can hold several patients, maybe sitting or lying down, and crucially, medical staff can go inside with the patients.
Oh, so if someone needs hands-on care during the treatment.
Exactly. In a monoplace chamber, the patient is alone inside once it's pressurized. Staff monitor everything from the outside. But in a multiplace chamber, a nurse or doctor can be right there.
Being sealed in a pressurized box sounds like it needs some serious safety rules.
Oh, absolutely. Safety is priority number one. These facilities have incredibly strict protocols.
Like what?
Well, fire risk is a big one. Pure oxygen under pressure makes things burn much more easily. So, strict checks, no flammable materials, no static electricity sources. Things like lotions or certain fabrics might be forbidden.
Makes sense.
The breathing gases are precisely controlled and monitored. Patients breathe the pure oxygen through a dedicated mask or hood system, separate from the chamber's internal atmosphere, which might just be compressed air. And there's constant monitoring of the patient heart rate, breathing, etc. from the control panel outside.
And who runs all this? It sounds like you need specialists.
You definitely do. It's a specialized field. You have medical directors, physicians with specific training and board certification in undersea and hyperbaric medicine.
Okay.
Then you have hyperbaric nurses who provide care, and certified hyperbaric technologists or chamber operators, CHTs, who are the experts in running the chamber itself, controlling the pressure, managing the systems. It's a real team effort.
Right. So walk me through a typical treatment session for a diver with decompression sickness. What happens?
Okay. So the diver is assessed. Obviously, diagnosis confirmed. Then they're helped into the chamber.
Monoplace or multiplace, depending.
Right. Once they're settled and the door is sealed, the operator begins increasing the pressure inside the chamber. This is called the compression or descent phase.
Do they feel anything?
Usually the main thing is pressure in the ears, like on an airplane. They need to equalize, pop their ears.
Okay.
Once they reach the prescribed treatment pressure, which depends on the treatment plan, often equivalent to diving down a certain depth, they start breathing the 100% oxygen through their mask or hood.
And how long do they stay at that pressure, breathing oxygen?
It varies, but treatment tables dictate the time. It might be, say, 90 minutes or more at pressure, often with short breaks, breathing the chamber air to reduce oxygen toxicity risk.
And someone's watching the whole time from outside.
Constantly. The operator monitors the pressure, the gas flows, the patient's vital signs, communicates with the patient via an intercom. They're in complete control.
Okay. And then what?
After the specified time breathing oxygen at at pressure, the operator begins the decompression or ascent phase. They slowly, carefully decrease the pressure back to normal atmospheric pressure.
Also controlled, just like a diver's ascent should be.
Exactly. It's a very controlled process, following specific schedules to ensure the patient is brought back to surface pressure safely.
Now, you mentioned equalizing ears. Are there other sort of side effects or discomforts people should know about? Not to be alarming, but just aware.
Sure. Ear or sinus pressure problems, barotrauma it's called, are probably the most common issue, especially during the pressure changes.
Yeah.
But usually it's manageable if you equalize properly. Staff coach patients on how to do that.
Okay.
Because you're dealing with pressure changes, people with certain lung conditions need careful screening, as there can be risks there. But again, patients are evaluated for contraindications beforehand.
Right, the screening is key.
And there is a theoretical risk of oxygen toxicity, basically. Getting too much oxygen at high pressure can affect the lungs or even the central nervous system. But the treatment protocols, the times, the pressures, the air breaks, they're all designed very specifically to keep that risk extremely low. It's well managed.
That's good to know. It sounds like while it's a powerful treatment, there are very established safety procedures.
Definitely. Decades of experience and strict standards are in place.
We've focused heavily on decompression sickness in divers, which makes sense.
Yeah.
But is this therapy used for anything else? Just briefly to give us scope.
Oh, absolutely. While decompression sickness was one of the earliest uses, hyperbaric oxygen is now approved for a whole range of conditions. Things like carbon monoxide poisoning, which we touched on.
Right.
Also, certain non-healing wounds like diabetic foot ulcers, crush injuries, specific types of infections, radiation injury. The list is quite varied, actually. It shows how manipulating pressure and oxygen can have broad medical applications.
Wow. Okay, so it's not just a diving thing.
Not at all. A very versatile therapy, though our focus today was definitely the diving connection.
So to kind of wrap this up, what's the main takeaway for our listeners about hyperbaric oxygen therapy and helping divers with the bends, with decompression sickness?
I think the core idea is pretty elegant, really. You use pressure, increased pressure, and high concentrations of oxygen together.
Right.
The pressure helps shrink those dangerous nitrogen bubbles that formed during a too rapid ascent, and the superoxygenated blood helps dissolve that nitrogen away and promotes healing in tissues that might have been damaged. It directly tackles the root cause of the problem.
So simple physics, really, applied in a very clever medical way.
Exactly. Pressure and oxygen working together.
And hopefully everyone listening now feels like they've got a solid handle on how this important treatment works, at least the basics. You've successfully completed your mission for this deep dive.
Absolutely. It's pretty amazing when you think about it, how we figured out the body's response to these extreme pressure changes and then developed such a targeted solution.
It really is. Makes you wonder, doesn't it? What other ways could we use our understanding of basic physics or physiology to tackle health problems in the future?
That's a great question to ponder. There's likely still so much potential out there.
Definitely food for thought. And if listeners are curious and want to learn more, especially about the details or the other uses we mentioned.
A great resource is the Undersea and Hyperbaric Medical Society, the UHMS. Their website has a lot of reliable information for both professionals and the public. It's a good starting point for digging deeper.